but I will tell you what is it. Not that you're going to be doing it, but because once again, all these textbooks, all these questions, most of these questions are obsolete already. They shouldn't be in this textbook for medical assistants, but they still keep it. And the exam still ask about some questions that actually at this time you are not allowed to do it. But we have to go over those things because you're going to be asked. And I want you to get as many questions as possible correct. So remember, preparing medications, giving medication, it's a no-no. The prescription refills, you have to be very careful because you can do it when you are authorized by the doctor to do it in this particular patient. That's it, but you have to notify the patient first. Other duties allowed by state regulations and under physician's direction. See, that's very important to understand this point. State regulations. Each state has their own regulations. Whatever you're doing in this state as a medical assistant, maybe it's a little different in another state, because each state has their own regulations for all the professions. So remember that I told you that back in the days, there were some states that allow medical assistants, after they've been trained properly, of course, to prepare and administer medications. Just because it's directed by the physician does not imply that you can do it. Remember, always keep in mind the things that I tell you. Don't do it. Don't do anything just because the doctor asks you to do it. These medical doctors don't know what your scope of duty is as a medical assistant. So they think that, oh, you're a medical assistant, you can do this. Because the doctors don't do it. We don't prepare and administer medications. We don't. We have the nurses. But the problem now is financial. We're just going to finish this part and we're going to be gone. These doctors nowadays, remember, they have to pay a nurse, and how much a nurse charge to work for them? A lot of money. Well, they want to train the medical assistants doing this and that. But the training that they gave you is just hands-on. Oh, do it like this, put it like this, and then they're going to put you in jail like this, because nobody's going to be interfering or being on, speaking on your behalf. So don't. So this is the way that you are going to respond to a doctor, to a nurse who asks you to do something that is not part of your scope of duty. You're going to be very professional. Always remember, if you have an attitude problem, you're going to have a problem. You already have a problem because that's an attitude. So you have to be very professional. Oh, hi, doctor. I would love to do that. But you know what? My scope of duty, my certification, my state regulations do not allow me to do that, even though if you train me. I would love to, but unfortunately, no. You know what we can do is, oh, I saw this nurse that was busy over there doing something. Maybe I can do that and she can come here and do the job. Or even better, what I learned myself, because I was asked to do a lot of things that I wasn't supposed to be doing. Because that's what they do. Remember, nurses wants to use you, medical doctors wants to use you, and whether they know or not, nurses know very well, but doctors sometimes they don't know, but they ask you. But it depends on you whether you goes with it or you stand for your rights and you say, this is not me. So that's basically what it is. So another thing that you can tell the doctor is, okay, doctor, if you train me to do so, well, they're not going to have time to train you. If you sign right here that you are authorizing me to do this job, I might do it. Do you think that they're gonna sign that paper for you? They knowingly that they're gonna get in trouble if you do something wrong because you're not supposed to be doing it? Now my signature is right there. My license is on that paper. Oh no, I'm not gonna ask you to do it. But you have to be very professional how you respond. Look what one of the medical assistants did to one of my colleagues, medical doctors. He says, Bernice, can you please do me a favor, do this to this patient? I said, what do you think I am? I'm not stupid. You know I'm not supposed to be doing that. You want me to get in trouble? Oh, listen, this is not how you respond. I'm asking you something. I don't even know if you're going to get in trouble. Probably you don't know. Probably you know. But that's not the way that you behave. This is a doctor asking you to do something. So that is being insubordinated. So she was fired for insubordination. So be careful how you respond to things. Yes, we learn some stuff, but it's sometimes, remember, it's not what you said, it's how you say it. Be careful. It's very important for us to conduct ourselves. When we get to the other chapters that is about communication, we're going to learn all that. Because this is very important. Sometimes you might think that it's a little boring, but it has a lot of substance when it comes to application this to your workplace. Because we think that we know many things, but when we encounter ourselves in the real situation with the real patients, with these doctors giving you orders, you're gonna think twice. If you don't know it, but when you know it, you know how to handle it. But if you don't know, that's exactly what you're gonna be doing. What I told you about this medical assistant, Bernice, I remember her. Okay, so we're done for today. We're gonna leave it right here. Tomorrow is another day, and we have a lot of material. We just started, just getting you started right here. So thank you for attending the class, and I will be sending you the results not tonight, maybe tomorrow, or from your exams. I'm grading them, so as soon as I grade most of them, I'm gonna start sending you the grades, okay? And if someone has not sent me the test yet, please, you still have time. And that's it. See you tomorrow. And we're gonna continue with this part of, this module that is part of the administrative subjects. Any questions before we go? Okay, probably not. So see you then tomorrow. Take care, guys. Thank you again. Good night.
Good night.
Bye now.
Good night,
Take care.
teacher.
See you then.
Good night.
Good night.